Infertility is certainly a very heavy cross to bear for many couples. There really are a number of causes. Some are simple, some are complex, and we kind of peel through those layers to try to restore normal health and function to the man and woman in order to best increase their chances of conceiving. So I think some of it depends on the clinic that one goes to. Often there is a workup for hormonal causes and underlying abnormalities and imaging. But often if it is not a quick, easy fix, then typically the next step is moving on to more invasive procedures like in vitro fertilization or IVF.
That's the first method that comes to my mind. So what exactly is in vitro fertilization? And then why is it that we as Catholics have a problem with it?
In vitro literally means in a dish or in a tube. So by definition, it means outside of the body. And the way this is carried out, a woman would go to a fertility specialist and be given medications to actually slow down ovulation for a short amount of time. And then she would be given medicine to help her produce a high number of eggs all at once. And then those eggs are obtained through a procedure. And the sperm is also obtained from the man. And then those are combined in a laboratory in a dish. And about anywhere from a few to up to 20 embryos are created during this process. And then after that, the embryos are selected based on different characteristics. Usually in the United States, they select 2 embryos for implantation, and then those embryos are implanted into the woman. The woman would then go home and hope for a positive pregnancy test in the next 1 to 2 weeks, which would indicate that those embryos had indeed implanted in the uterus. So the church argues really on the positive side that the child has a right to be brought into the world in the act of love between a man and woman, and that right is superseded by any technology or advance that we have to create life outside of the body. And then it also gives more dignity to the baby in allowing them the right to be brought about in an act of love.
So Dr. Day, of course, there are other obvious problems with that as well. The famous octomom, for example. I suspect it's a true statement that it would not even be possible for a human being to have 8 eggs and thus 8 children. So you either have the implantation of many eggs or you have the discarding of many fertilized eggs. Maybe explain a little bit about that process, why that's another problematic part of this process.
Yes, I'm glad you asked. So in the process of IVF, the creation of anywhere from a couple to up to 20 embryos, question is what happens to those embryos that are not implanted into the woman? They are often frozen in storage, and most embryos are frozen indefinitely in kind of this suspended state, if you will, where they will not be used. And so unfortunately, IVF almost implicitly involves abortion. And another unfortunate way of doing IVF is if many embryos are implanted in the woman, but they feel there are too many that have implanted and are starting to grow, then the process called selective reduction, which is kind of a code word for saying really aborting the babies that they feel aren't the healthiest to allow for the 1 or 2 most healthy to grow.
Do we have any numbers about how many frozen embryos we have in the United States right now?
If you go to the CDC, the Center for Disease Control, the statistics for IVF are actually public knowledge. As far as the number of frozen embryos, it would be a little bit of an estimation based on the number of births that have occurred in IVF. But since 1987 to about 2015, about 1 million babies were born through IVF. And so I think it would be reasonable to assume at least a few frozen embryos per live birth. That would put us in the millions range.
Wow.
For sure.
What about surrogacy? Surrogacy is something that we hear about. Do you know much about commonality of that in the United States and regulations against it and such things?
I don't have specific stats. I believe it is on the rise a little bit. There's different types of surrogacy, and it gets pretty complicated pretty quickly because you can have a mother who is going to bear the child and a sperm donor who is not married to the mother. You can have the father in the couple and then a donor egg, and then that is carried in the woman that's married. So that's actually called heterologous IVF, when one of the biological parents is not part of the married couple that will raise the child. So that's more heterologous IVF. Surrogacy is really when a woman bears the child for someone else. And often that will be a donor egg and donor sperm from another couple. Sometimes it will even be the woman's own egg, but she is carrying the baby for someone else who maybe is unable to have children and then uses donor sperm, and then they give that baby up to the mother who desired the baby. The difficulty with surrogacy, obviously, is a lot of times there's some issues with legalities of parenthood, because you have biologic parents and someone who bore the child, you have someone who desires the parents, and so it can get pretty complicated pretty quickly. And again, the issue is that it's separating that kind of nurturing environment from the intended mother for those who would be raising the child. And again, even though the seeking of life and to raise a child is a good thing, we have to be really mindful of the way we bring that about.
So, well, let's be positive now. Talk about NAPRO technology. So you begin, I say you because you're part of a group of doctors who do this right here in the Cincinnati area. So what are some causes of infertility, and what are some ways that we can help a couple who is experiencing infertility?
So what we usually do is we look at a woman's chart and we bring the couple in, and based on that, we get a series of lab tests called a hormone profile. The most common things we find actually are low levels of estrogen and progesterone. Progesterone is a very important hormone for pregnancy, produced by the body mostly in the second part of the cycle, and it has a lot of control over the next cycle even, and can play into fertility there. So in one study done in Ireland, they found that 86% of women that were seeing them for infertility had some low progesterone. Now, that doesn't mean that was the only thing at play, but something that is specific to NAPRO that we look into are those hormones. There are other things like cervical mucus production. We know that as something that we use to monitor fertility, but it also is actually the vehicle for the sperm to survive. And so if a woman isn't making cervical mucus, the sperm cannot live for very long at all, and the chances of pregnancy are quite low. Now, other causes are endometriosis. Now, that's a condition in which the uterine lining is outside of the uterus and causes inflammation. And that is often a surgical disease in which we will refer to one of our surgical partners to remove the endometriosis. And one really beautiful thing about NAPRO technology is that those surgeons are specifically trained to cut out the endometriosis and not just cauterize or burn it. And they also are trained in very specific ways to provide types of treatment within surgery that really reduce the risk of what we call adhesions or scar tissue, because those can cause a lot of inflammation and be impactful in fertility. And there's even another condition called polycystic ovaries. About 10% or more of women will have that. And that's something that we can treat as well with different medications and lifestyle changes.
So, Dr. Day, the first two you mentioned was low estrogen and then low mucus. So can you treat those directly? Like, is it a shot or a pill to treat the estrogen situation? And then how do you treat the mucus situation?
So for low levels of hormones in what we call the luteal phase, or the second part of the cycle after ovulation has occurred, when we see those low hormones, we actually just treat with those hormones. So we use what we call bioidentical hormones, which basically means it's the same chemical that your body makes, but it's in a pill or medication form. And we'll use those at targeted times of the cycle, because in a woman's cycle, the hormones are not the same all 30 days or however long the cycle lasts. They fluctuate significantly. And so we use them at targeted times to treat them when they are low based on the blood work that we got the prior cycle. For limited cervical mucus, there are a number of supplements and medications that we use to help the woman produce adequate cervical mucus for sperm survival. Some of the more difficult treatments, and we'll probably show a website at the end that has some of these statistics, but IVF, typically an often cited percentage of success per cycle is about 30 to 40% of pregnancy being achieved in a given cycle. And there's a breakdown by specific diagnosis. So some of the things like the endometriosis that we talked about are a little more difficult to treat. But as a whole, in all of these breakdowns of these subtypes of causes of fertility, in the studies, NAPRO technology really is as good as, if not a little bit better than, achieving those pregnancy rates depending on the underlying cause. So it's not only as or more successful, if you will, in achieving pregnancy, it's also less invasive for the most part, less expensive, and of course, works cooperatively with the man and woman to give them the dignity they need in their marriage. There is a website called naprotechnology.com, and they have a list of resources there on success rates and statistics. And I won't go through all of the details, but it basically breaks down success rates of NAPRO technology in comparison to IVF with different types of treatments. The text goes over some of the details, but the numbers are really promising. This research has now been going on for over 40 years, it shows the success rates are really there. And again, in ways that work cooperatively. So if people want to check out those numbers and statistics there, that's a good breakdown of them. There are other cases where we do all of the workup and all of the treatments, and sometimes we find that there are things that are, difficult to treat or still even difficult to diagnose, the human body being so complex. And often a lot of my colleagues who also practice NAPRO will tell me stories that even if a family ends up not being able to have a biological child of their own, if they go down the road of adoption or something else, they're very grateful for the workup, the treatment, the approach that really treated them with dignity and respect, that allowed them as a couple to really maintain that privacy, that intimate love that they deserve, and allow them to be at peace, even while they carry that cross, allow them to be at peace and kind of knowing God's will in their life. So that can also be a blessing, even though the story doesn't turn out quite as they had hoped. The journey allows them to grow, and it's a privilege to be part of that process as well.
I was going to ask, I wasn't sure but it says it's right here, male infertility. So what does NAPRO technology offer if the problem is with the fertility of the man?
Often we will obtain a seminal fluid analysis to check sperm count and other potential problems with male fertility. And there are some treatments if they have low hormone levels, like low testosterone. And if there's a surgical issue or something else going on, we'll often work with our urology colleagues to help get them back to normal health. In many pregnancy cases as well, even in suboptimal male sperm count cases, if we are able to optimize all other factors, then a patient's chance of pregnancy increases significantly. One website I forgot to mention in the area is the Couple to Couple League. They have a wonderful website with a lot of resources for people who are looking into ways to, learn how to monitor their fertility. So they use different types of fertility awareness-based methods and are very knowledgeable in that. And they have a number of very good resources there as well. So at ccli.org, there's a number of ways to find classes to learn how to start charting, which is really the first step in learning how to approach fertility, infertility, or family planning. They can also give you resources on practical tips, health habits, and different resources in the area that would allow a couple to really kind of get off on the right foot and learning more about it, and some data and research behind it as well.
And you can learn it. You can even get involved and volunteer. You can even support it. So if a couple is having trouble with fertility and they want to find you and your practice and make use of NAPRO technology, very successful as well as ethical and morally friendly technology to help people with the difficulty of infertility, how do we get a hold of you in your practice?
So they can call our office. We're at Montford Heights Family Medicine, affiliated with Mercy Health. Myself and one of my partners who also practices NAPRO technology would be happy to see a couple. We even recommend you visiting one of these websites we mentioned beforehand, so they have a jump start on charting and kind of the understanding of what's going on in the cycle, and that helps us get off on the good foot to begin the workup.
Before you go to your first appointment, if you want to go to those other websites mentioned to learn a little bit more about how to track your fertility, that would be the first step anyway. Terrific. Are there, some of our listeners might be all over the world actually, but most of them are going to be in the Archdiocese of Cincinnati. So some will not be all that close. Some might be in Dayton or Northern. Is there anybody other than you here in this Archdiocese who is knowledgeable of NAPRO technology that you're aware of across the Archdiocese?
Fortunately, there are. So Cincinnati has a number of providers, and most of them are actually listed on the Archdiocese website. Another doctor in the Mason area, Dr. Lauren, and then there's a nurse practitioner, Amy Fathman, who's in the Northern Kentucky area as well. And then there are some providers in the Dayton area.
I really appreciate you taking the time to discuss IVF and other problematic solutions to infertility, but then more positively, educating us on NAPRO technology and how it is that we really can help so many couples who struggle with infertility. I'm sure we've learned a lot, and thank you for spending time with us today.
Thank you so much for having me.
And I want to thank all of our viewers and listeners for tuning in on this episode of our Being Pro-Life series. Head to the website, view all the links talked about in this episode at www.catholiccincinnati.org/being-pro-life. Thank you again for joining us today, and I look forward to being with you next time.